Have you ever had any disagreement with your mom?
For sure. But I think, we can agree to disagree, but I think at the end of the day, we just focus back on why we're doing things.
At work, you don't call her mom, right?
No, I call her Dr. Gan.
Chin Wei Chia is the Group CEO of HMI Medical, a regional healthcare group in Singapore and Malaysia. It provides a range of services from hospitals and ambulatory care to GP clinics. The company's roots trace back to Balestier Medical Centre, which was co-founded by her father, Dr. Chim Koi Nam. Her mother, former nominated MP Gan Si Kam, expanded the business. It was also her mother who asked Ms. Chin to join the family business in 2002. In 2025, Ms. Chin was named Singapore's EY Entrepreneur of the Year. I'm Sumiko Tan from the Straits Times. I'm meeting Ms. Chin for lunch at the Chia He Grand Chinese restaurant at One Farrer Hotel. Did you grow up wanting to be in the family business?
As I was growing up, I think what really impacted me was the idea of inequality in the world, why some countries are doing well and developed and why others are not. I think that's what drew me into industries that make impact. Healthcare, education, because my father's a doctor, my mother was a business school professor. I think those were always areas that resonated a lot with me.
Right, but your mother had to make a call.
She did. She literally gave me a call and said that I need help. So this was in 2002, after September 11, and I came back to support her in a period of restructuring, and it was a deep dive into the business. It was also a great learning experience because I believe that when faced with the biggest challenge, that's where the greatest learning is. And it really made me believe in the need to constantly disrupt ourselves so that we're always ahead of the curve.
What would be one disruption that you saw through?
So I won't call it really a disruption, but you can see it coming, right? So aging population, chronic disease, increasing cost of healthcare, and that's why we also took that opportunity to spark the change within ourselves into really building a connected ecosystem. We're able to support people before they are patients. We're able to support them in their homes through telemedicine or in a neighborhood clinic. When they need specialist care, they can come into our different specialty centers, right, including Eagle Eye, Advanced Urology, different specialty centers of excellence. We have more than 2,000 clinics on our network, and we work with wellness providers. Our role is to make healthcare simple, to help people navigate what can be a very confusing and convoluted system at times.
Your parents were the ones that started the business?
Yes. My father's a doctor, and he and a group of his friends who are doctors decided to start up a small hospital in Singapore, which was doing well until the Asian crisis. My mother was a business school professor, and she was also working in her family business, property and real estate. When the Asian crisis hit, she decided to focus a bit more on what HMI was doing and really help transform the business, converting the Singapore operations into healthcare education and our social enterprise today, where we train thousands of people for jobs in healthcare.
You worked with your mom under your mother. Have you ever had any disagreement with your mom?
For sure. But I think, we can agree to disagree, but I think at the end of the day, we just focus back on why we're doing things, right? So if we know the why, then the how is something that can always be navigated.
At work, you don't call her mom, right?
No, I call her Dr. Gan.
So your dad is not quite involved?
No, he focuses on patients, and it's really nice. Like, not everyone knows that the doctor that they see is my father. So when they give feedback, sometimes they say, "Oh, I just went for health screening, and the doctor was very nice." And then I was like, "Okay, who was that?" And then they describe, and then I was like, "Okay, that's my father."
And you also do training, which
Yes.
you are quite passionate about.
Yes. We have a social enterprise where we train people for careers in healthcare. It was my first project when I joined HMI to convert the small hospital into a training center, witnessing the impact it has on people and their lives, and also seeing people continue to grow. It's really, really nice to see that impact. And we also do a lot of home caregiving training when a medical condition hits, the family is usually not prepared. Through our social enterprise, we're able to champion some of these trainings and knowledge, and we put a lot of information up available online.
What's the most rewarding thing about your job?
I think it's actually the people that I work with. When we are able to support each other, when we're able to kind of bounce ideas and kind of challenge each other to grow, to do better, I think that's something that's always very rewarding.
It's different. There's a lot of strategic stuff that I have to do, set the scene,